Hello, welcome back. Today we are going to talk about septic shock. We will discuss this topic in detail because this is a very important topic for the exams and for clinical practice also. So we start our topic with etiology. Sepsis can arise from both community acquired and hospital acquired infection. Of these infections, pneumonia is the most common source, accounting for about half of cases. Next most common are intra-abdominal and genitourinary infection. Blood cultures are typically positive in only one-third of the cases, while many cases are culture negative at all sites. Now, Staphylococcus aureus and Streptococcus pneumoniae are the most common gram-positive isolates, while E. coli, Klebsiella species, and Pseudomonas aeruginosa are the most common gram-negative isolates. The many risk factors for sepsis are related to both the predisposition to develop an infection and once infection develops, the likelihood of developing acute organ dysfunction. Common risk factors for increased risk of infection include chronic disease such as HIV infection, chronic obstructive pulmonary disease, cancers, and immunosuppression. So there are certain definitions in sepsis and septic shock which we need to know. The first one which we need to know is SIRS, that is SIDS. SIRS stands for Systemic Inflammatory Response Syndrome. In simple terms, this is the body's response to inflammation. Now, this inflammation can either be infective or non-infective. Like it can be secondary to infection or it can even be secondary to trauma. So it's not necessarily that it's all because of infection or sepsis only, right? Now, this is mediated by IL-1, that is interleukin 1, IL-6, that is interleukin 6, and TNF-alpha, that is tumor necrotic factor alpha. These interleukins control the SIRS response of the body. So, SIRS criteria include 1 point for each of the following parameters, and the score range from 0 to 4. So, what are the parameters? The parameters are first, temperature less than 36 degrees centigrade or more than 38 degrees centigrade. Second, WBC count less than 4000 or more than 12,000 or more than 10% band forms in peripheral smear. The third parameter is tachypnea with more than 20 breaths per minute. And the fourth and the final parameter is tachycardia with heart rate more than 90 beats per minute. So these are the 4 parameters which you need to remember regarding SIDS. If any 2 parameters are met, then we say that the patient is having SIDS, systemic inflammatory response syndrome. Now, discussing the definition of sepsis. We will discuss the old definition first. So, sepsis is SIDS plus a known foci or known site of infection. Okay. Now, septic shock. Sepsis plus hypotension which fails to respond to fluids, that is septic shock. Modes means multiple organ dysfunction syndrome. So modes is when there is failure of 2 or more organ system. That is when we can say that patient has modes, and this has high mortality rate. So these are certain definitions which we need to remember. In the next video, we will going to continue our topic with SOFI score. And if you like the content, please subscribe the channel. Thank you.